For years, the National Institutes of Health have been working with doctors to treat patients who've had chronic burn wounds more than a year old with bone marrow stem cells. In clinical studies, some patients saw rebuilding of skin tissues, recovering of pigment, and were also saved from amputation. Doctors are now focusing this stem cell treatment on injured military members and young civilians who've recently suffered burn injuries.
We looked forward towards advancing this trial towards our veterans who are severely impacted by injuries that they received during combat. And we created a trial that would address that need. That trial was supported by the Department of Defense from the start.
Doctors say adult stem cells from bone marrow, which is not embryonic, donated by young, healthy donors, can be applied to burns topically or through injection.
The approach has multiple levels. One, it'll stop that inflammatory process and stop the progression of the burn injury. And the other is we've seen from the previous trials we've looked at that there actually is rebuilding of tissue.
Leroy James suffered a severe burn injury on his arm just 7 months ago. He received stem cell treatments and is now fully healed and says he suffers no side effects.
Usually when you get burnt, you have a scar. I have no scars. This stem cells. Now I have a burn on this arm I got from a radiator. I got scars.
Researchers conducting the experimental trials at the University of Miami say they are very excited about the results so far and next hope to narrow down exact dosages for specific injuries.
One of the interesting things about these trials is, and there have been over 400 trials ongoing or completed with these types of stem cells, is that there have been no real significant adverse events been reported directly related to the delivery of these kinds of cells. What has been in question is what is the most efficient way to use these cells to achieve an optimal effect. And that's really where a lot of our research is focused on finding the correct dose.
Doctors say there are no health risks donating bone marrow, and they encourage healthy people to help treat dozens of patients. To find out more on stem cells for burn injuries, go to clinicaltrials.gov. In New York, David Lee Miller, Fox News.